previous strikes? How does this differ?
So the other ones, they're more like informational pickets where no workers are actually striking. They're either coming out on their lunch breaks or on their days off to come and talk about concerns inside the hospital. Whether it's mostly unsafe staffing levels, which impacts patient care. The hospital will tell you otherwise, but when you're working on med-surg and your patient hasn't gotten a bath in a week because there's no nursing assistants available to provide enough patient care to the patients, as a nurse or care provider, you're really concerned, and that's why people come out to show to the community that things are not okay here, no matter what administration at St. Joseph Hospital is saying, because they're in their ivory towers in their offices wearing their business attire. Meanwhile, we're wearing our scrubs. We are on the front lines of patient health care, and when they say otherwise because they're concerned about their bottom line, the next quarterly profit, and that's all that matters to them. And today this is an actual strike where we as membership voted 91% to strike yes over unfair labor practices in our union negotiations and to talk about unsafe staffing levels. So it's been almost 3 months now since the hospital last met with us to meet us at the table for union negotiations, and that's unfair labor practice. So that's why we're out here. It's not about economics, it's about unfair conditions. As my perspective on the city council, when I've done union negotiations at the table or directing staff members who sit at the table, to be cautious and careful with the members' feelings and how we display our professionalism to them. We like to do it's called faith-based. Sorry, it's a type of model negotiation, needs modeling, where we work to discover the needs and of the employees and between the city, and how we can be effective and work together. Here at St. Joseph Hospital, they've hired union busting attorneys to just try and drive a wedge between membership. They're displaying tactics to cause fear among memberships to not strike, and we've had some members unfortunately cross the picket line because they're fearful of not getting paid, because pay is such an issue for some of the lower salary individuals, and also just fear of losing their jobs. So the hospital is just being a bully, and it's just the same story with St. Joe's over and over again, is that to me when they insult the workers and the work that we do, in a way they insult the community as well, because all of us do this work because we like to help people. We like to help our community members, and when we don't have all the tools available to us to do the best job we know we can, it's very insulting when we look and see that our CEO went from making $4.8 million to $11 million with the merger. It's like we know they have the funds available to really do a much better job in patient care and delivery of expectations, but they don't allow us to get there. And for example, my job as a monitor tech, before the cuts, I'd almost always have a second monitor tech with me, so it would be two individuals watching 40 patients at a time. But after the merger, they cut one position, so it's just one person now to watch 40 patients. Our workload has doubled, and that's just my position alone, not to mention all the other employees in the hospital who are being asked to be more productive and work harder with less staff and less tools to do the job that they want to do. They hate unions. To me, unions are a great tool for the workplace. I'm happy city employees, the firefighters, the police officers have unions, because there comes democracy with that. They're able to vote and decide as a collective body what's important to them, so we can do a better job in supporting them in their roles in the workplace. And the same thing could happen here at St. Joe's. We as membership could show concern about things that are happening in our job, and they as an employer should honestly be obligated to work on those things. If things are all hunky-dory, we'll say it is. We'll say things are great here, and they're not, and that's the unfortunate thing. And I hope at least, at the city level, like the unions, they can say at least we're trying our best with the budgets that we have and the transparency that we can show them, that we're trying our best to support them and make them feel supported and respected. But here, that's not the case.
Yeah. Okay, thank you. I think that's good. Do you have anything you want to add?
I mean, I know Roberta has a tough job, quote unquote, but really their PR strategies in dealing with these issues are amateur hour at best. I'm happy to say that to Christian Hill, to his face, the chief strategy guy here at the hospital, because everything he does or says, it just sounds condescending, it's passive aggressive, and honestly it sounds extremely whiny, and it divides the community. I would honestly, if I was a community member, I would not donate to this place any longer. And I know a lot of community members have over the years. They helped build this hospital and build what it is. And to hear how whiny administration is, to hear how they funnel all of those charity donations, to other, they disappear that money, or they, you see these administrators with huge executive pays. I mean, it's really just satisfying. If I was a community donating member, I would donate to something else immediately, where I knew if I spent $1 on something, it would get spent the right way.
Right.
Monitor techs watching our patients all the time. They have 40 patients to watch over. Typically, there should be 2 monitor techs, and often there is 1 who's also responsible for the code phone, all of the alarms that go off, code reds, anything else that happens all over the hospital, not just our unit. For 3 years, we've been asking management or